New information is emerging about the coronavirus as the Bay Area fights to keep the number of cases down. Are some of us protected from the virus, and is there new treatment? Joining me now by Zoom is Dr. Maja Artandi of Stanford Health Care. Thanks so much for joining us. First, we've been talking about the race for a vaccine, but companies are also testing an antibody treatment. Where do we stand on that?
So the thing with the vaccine is that it won't be out and readily available for the wide population for many months. And we don't have any good treatments for COVID-19 to treat or prevent it. So there is a ton of enthusiasm about antibodies to treat and prevent COVID. Currently, I think more than 70 antibodies are being tested if they work. The way that the researchers develop those antibodies, if they take a patient who has recovered from COVID and isolate antibodies from the blood, and then they look which antibody works the best, and then they mass produce it. The thing with antibodies is that there will be in no way any substitution for a vaccine. Number one, they only last for 1 to 2 months, so they will not give you lasting immunity. They are incredibly expensive, very difficult to make, and then they can only given with injections. So companies, maybe if it's proven that they're safe and effective, and right now we don't even know that yet, they can make maybe 100,000, a few 100,000. Studies have shown that we need about 60 million doses of antibodies. So, and then the decision has to be made who gets those antibodies and who doesn't. So that's also logistically quite difficult.
We know there's a new study that shows about 40% of people infected with COVID-19 show no symptoms. Why might some of us be partially protected from the coronavirus?
That's a really fascinating aspect of it. Myself and other clinicians who treat patients who are suffering from COVID are often puzzled that some patients get really sick and other patients who have COVID-19 are in the same family have almost no symptoms or no symptoms at all. And the truth is, we don't really know yet why that happens. There are several theories out there. I mean, we all know that if someone is older or has pre-existing conditions such as diabetes or heart disease, they have a higher risk of getting severe COVID infection. But then there are other theories out there why people might be asymptomatic. One of the theories is that some people have partial immunity. And that's because they have been exposed in the past to other coronaviruses. As you probably know, coronavirus can cause the common cold. And if people have been exposed to those, they might have partial immunity. This immunity, that's fascinating, is not mediated by antibodies, but by another part of the immune system called the T cells. And research are just starting to look in the T cells for COVID-19 immunity. Another theory that researchers are following is the role of mask. So if someone wears a mask, they will be exposed to a lower dose of the virus. And if someone is exposed to a lower dose of the virus, they will have fewer symptoms. So wearing masks can actually help people be safe from the coronavirus. So it doesn't only protect the environment, but it also protects the wearer of the mask.
So what are the chances that COVID lingers in the body even after patients recover from it?
Unfortunately, there are lots of things that we don't know about the coronavirus yet. It's been only about 7 months since we even knew about this virus. And one of the things we don't know is if the virus can stay or linger in the body even after the patient has recovered and has no symptoms anymore. We do know that some patients, even months after they have recovered, still have RNA from the virus in their upper respiratory tract. We don't know why that happens. The concentration of the RNA is much lower than when they were symptomatic, and they're deemed not infectious. So the CDC has issued the guidelines that someone who has mild or moderate COVID, meaning they were not admitted to the hospital, they are not infectious anymore 10 days after symptom onset. If someone was in the hospital and has more severe symptoms, that patient is deemed not infectious anymore 20 days after symptom onset.
You know, we've been reporting that younger people are making up a larger percentage of COVID cases. Is that still the case?
Absolutely. At Stanford, at the COVID clinic, we see a much higher percentage of younger people. Up to a few weeks ago, the percentage of patients under 50 was about 25%. And then in the last several weeks, that has increased to 55%. So 55% of our patient population now that we are following as in the outpatient clinic are younger than 50 years old. And it's not only at Stanford where we're seeing that, but the other Bay Area counties are seeing that too. Now the question is, why do we see a higher percentage of younger patients? And we really don't know completely, but the theory is that younger patients still think that they will not get sick with the coronavirus. And it's true, we do see more serious coronavirus cases in the older population or patients with pre-existing condition. But that said, I have seen young patients who got really seriously ill. And if you look at the rate of hospitalizations, younger patients are now also being more frequently hospitalized with the coronavirus. So there's more and more data coming out about the so-called long haulers. Those are patients who had COVID and then they have persistent symptoms. As I said, it's hard to now predict if it's going to be lifelong because it's been only 7 months since we know about this virus. But I have seen patients in clinic who have pulmonary or cardiology or even neurological problems. So many patients have a cough, they have shortness of breath. And if you look at the CT of those patients, they do have lung scarring. I don't know how long this will last. A cardiology, myocarditis, which is an inflammation of the heart muscle, is a complication of COVID. Patients who had COVID can have a higher risk of coronary artery disease with heart attacks later on in life. There's even some data that COVID-19 can increase the risk for Alzheimer's disease. So there are a lot of potential long-term complications, but right now it's still too early to really say what's going to happen with those patients.
Dr. Artandi, are there any particular types of face masks that are more effective than others?
Absolutely love that question because I see so many patients with different face masks and we all ask each other, what is the best face mask? And there was a study done by physicists at Duke University who asked that question. They took 14 different masks that were commonly worn. And what they did is they had a person wear the mask and not wear the mask. And then they visualized the respiratory droplets. And with those droplets, the virus is spread with a laser beam. And then they counted the respiratory droplets. And so they could completely compare masks. I know that you probably know the best mask was the N95, that the professionally fitted N95 that we as medical professionals wear. The surgical mask that you can get in pharmacies or even the cotton mask that you can make at home were pretty good too. Bandanas or knit masks didn't do a thing, so I would completely advise against wearing that. And then sometimes you see people running with gaiters. I mean, you see those when people are skiing, those fleece things. They actually make the spread of respiratory droplets worse. So I completely advise against wearing those. It's better not to wear a mask than wear those. So we think it's because the neck gaiter can actually, it gets moist, and then it makes the respiratory droplets even smaller, and so they're easier to spread. And that's why.
Dr. Maja Artandi of Stanford Health Care, thank you.